All right, this is Carla of the valgus knee. Okay, so I'm going to point to you. If you take a look, this was her selfie, and so she put a little smile there. You see this is a little dropped, and if you follow down this line, look at her medial arch. There was a bunion surgery here, and it's not free to move, and it's kind of stuck. Carla of the valgus knee. Okay, let's see. Ooh, that was about 8 visits. It's evened out now, and that bunion surgery on that great toe doesn't have that much of an effect now. Whoops, back. All right. This is, oh, I forget her name, but she lives out in San Diego, and she's a patient of mine. She moved out that way, so that's 3 hours from where I'm at. And, oh, whoops, jeez. Sorry, I'm not used to this. It's been a long time since I've lectured. Okay. A horse stomped on her. First time she went horseback riding, threw her off and stomped right there. And so she let it rest, and she knows, I don't want to see people who are freshly traumatized within a day or two. I let that settle, get the information out. And so she waited for a month and it didn't resolve. And I promise you, I don't know how to Photoshop. But if you take a look at the blood flow and that massive bruise, much better, 30 minutes. That's traditional osteopathy. Okay, let's get on to the good stuff. We're getting really close to the good stuff. There's a patient of mine, one of my patient's husband. He had an ACL surgery, and he's really functional, a senior citizen on the softball circuit. And if you take a look, he's functional and he's happy. He doesn't think he needs anything. But when he lays down, look at the tension here. Look at the shiny stretch on the skin and the color. Look at the tight tendon. And then his wife brought him in to see me for the first and last time before they moved to Colorado. There. And this was before I learned prolotherapy from this wonderful group. Man, think of what we could have done there. This was just plain old, good old-fashioned 10-finger osteopathy. It softened up a little here. The distance there softened. Look at that. He's starting to get wrinkles. So when we get increased blood flow and venous return, guess what happens with the skin? It wrinkles because it's been stretched out by congestion previously.